For Wall Street Media, this is Tyler. I'm here with Doug, and we'll help you make money in the stock market with information you can't find anywhere else.
Hey, Tyler.
How you doing, Doug?
I'm doing great, man.
Yeah.
I love all the biotechs. Lazard have a great one. I can't wait to hear what's happening. What do we have?
Well, you can find the conference at wsw.com/webcast/LZ and the number 5. We've got Barry Labinger. He's the EVP and Chief Commercial Officer of Human Genome Sciences. Their ticker is HGSI. He talked about an array of promising products, including albuferon for the HCV market, which is in phase 3 trials. For lupus, which is incurable and has no approved treatment in 50 years, they have lymphostat B, which is in development in phase 3 trials. He also talked about Abthrax, daraplatinib. Daraplatinib was discussed, which has the potential to become an important new treatment for atherosclerosis. He then discussed the process development and manufacturing alliance with Hospira. We have Anthony DeTono, President and CEO of Neurogesics, ticker NGSX. He talked about how the company focuses on the development of pain management therapy. Their formulation is different from other companies in that it is localized as opposed to applied to the whole system. The benefit of this new approach is that it requires less exposure, has fewer side effects, and is more efficient.
Yeah, I really need something.
Yeah.
You know, I mean, I've got like the problems right now in my foot. And, you know, the solution is just take a whole buttload of Percodan.
Yeah, good solution.
You know, and sooner or later, you'll go unconscious or it'll help.
Bye, Doug.
Yeah. I'd rather just like my foot not to hurt.
Seriously. Let's see. Also, we had Dr. Frank Mansbach of Valiant Pharmaceuticals. Their ticker is VRX. He talked about the recent acquisition of Coria Labs to broaden their dermatology company, Dermatech. He also spoke in detail about retigabine, an epilepsy drug they are developing in partnership with OSK. Larry Cohen, President and CEO of VIA Pharmaceuticals, ticker VIAP. He talked about significant positive findings at AHA for VIA 2291, a promising new drug that treats atherosclerosis. Jim Fickenshire, CEO of Auxilium Pharmaceuticals, ticker AUXL. He discussed Dupuytren's contract, an unmet medical need affecting 3 to 6% of Caucasian adults. Also, he talked about Testim, 1% testosterone gel for Peyronie's disease. Harvey Berger of Ariad Pharmaceuticals. Okay. He talked about Daforolimus in phase 3 succeed trial for sarcoma. He discussed a partnership with Merck as well. He also talked about AP24534, a kinase inhibitor which may have broad applications in cancer, chronic myeloid leukemia, and acute myeloid leukemia. They're on track to nominate their next development candidate by the end of this year. Nasib Shamoun, CEO of Aspect Medical Systems, ticker ASPM. He talked about his company's critical care unit systems and technologies, sensors they develop that allow doctors to give an appropriate amount of anesthesia.
Wouldn't that be nice?
It would be really nice.
Yeah, since they gave me too much last time.
I think that's just kind of what they do.
Yeah.
It's either not enough or a little too much. And
yeah, I got 8 times the dose.
8?
Yeah.
That's a little more than... That's bad.
Yeah, they're really good hospitals here in New York.
So this has sensors that allow doctors to give an appropriate amount of anesthesia, which reduces the incidence of waking up during surgery and also reduces side effects of the anesthesia. Don Earhart, CEO of iFlow Corporation, ticker IFLO. He talked about the company's evolution to include not only post-surgical pain management capabilities, but also acute care services and infection reduction. In relation to that, he explained iFlow's recent acquisition of Acrymed. Frank Perrier, CEO of Forest Laboratories, ticker FRX. He discussed cariprazine for schizophrenia and bipolar disorders, and ceftaroline for MRSA. Also discussed was
Dudogliptin.
Thank you, Doug. You're wonderful.
It's a lot easier from this side.
No, yeah,
because I get time to think about it while you're actually reading on the fly.
Right. Dudogliptin.
Not that I'm not far. You're better. Anyhow.
And the agreement to commercialize Dudogliptin in North America. You're really a bad person.
I hear German Mike laughing.
Yeah, he's laughing. You two are gonna Get it someday. Michael Gray, CFO of Curis, their ticker is CRIS. He talked about their development of targeted cancer drugs, including GDC-0449, a first-in-class hedgehog pathway inhibitor candidate. He also talked about CUDC-101, which is designed to simultaneously inhibit 3 clinically validated cancer targets, the HDAC, EGFR, and HER2. It's currently in phase 1 testing. Gary Rastani, the CEO of Hansen Medical, ticker HNSN, he talked about Hansen's quest to become a global leader in robotics. Hansen Medical is developing systems for cardiac needs, vascular needs, and structural heart disease. Robotic capabilities allow doctors to be more efficient and accurate. And that's what we got from the Lazard conference there, Douglas.
Okay, that's for all of you people who haven't jumped out a window. We have change coming. I guess all of you know that. And part of the change that we have coming is everyone's very optimistic about all of the change we have coming. They're so optimistic that the Nasdaq's down 6.5% for the day, and they've expressed their optimism in the change that's coming by the Dow being down yet another 5% for the day. Do what I do. Move to Asia. It's the future. Jim Rogers is presenting tonight at the Roth conference.
Yep.
And that's what he did with his family. Europe in the 1800s, America in the 1900s, Asia in the 20s.
You know, I gotta buy a gun and I gotta stay. That's what I gotta do.
All right, too. You can be my American connection.
We're here every day at Wall Street Media. You can find us directly at WSMCO.com. Thanks.